Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go over sudden hip pain without injury. So a lot of times what will happen is you'll stand up and you'll feel a pain on going down your leg, right in your hip, going into your buttocks. You won't have done anything. You may just be walking along and all of a sudden this pain will grab you. You could be going down the steps. Bottom line is you didn't fall, you didn't have an accident, nothing happened in order for this pain, for you to understand why this pain started. But all of a sudden you can't walk, or you have shooting pain. So there's a couple things that play into this. So a lot of times sudden injury without pain is because of compensation that you have been doing. And most often that's what is occurring is the muscles around the hip, here, wind up getting tight. Now this can be from limping. Maybe you don't even know you're limping. Maybe you have plantar fasciitis and you've changed the way you walk. Maybe you went from walking in sneakers to now barefoot walking. A whole bunch of things can change why these muscles get tight. Could be a new mattress. There's a whole bunch of things that could cause the tightness in here. But what happens is many times when you're moving along or you go to stand up and you feel a sharp pain, it's because the knots in these muscles, either here or back here, have gotten to a point where they can no longer function. Your body is able to compensate up to a point, and then it cannot compensate anymore. So you wind up really getting this sharp pain, thinking it all of a sudden happened, when in fact it was something that was building up and building up. You probably had no idea it was coming, and then all of a sudden you're walking along and it grabs you. So what can you do when this happens? So first of all, you want to make sure that it is just a muscle strain or knots in your muscle. So I recommend seeing a professional, like a physical therapist, who could just diagnose it and make sure it's not anything more serious. But in that case, if it's not, then you can do certain stretches. So for a hip injury, if you haven't identified exactly which muscle it is, you want to make sure that you are stretching all sides of the joint. So the first one is you want to do what we call that hip flexor stretch in the front. Now there's a couple ways you can do this. You can reach back, you can hold on to something, you can reach back and grab your leg. Now this is going to hit more of the quad area, but if you're pretty loose, it actually will also go up into your hip flexor area. If you don't feel a stretch in the hip flexor, you can just do a lunge, turn your body forward, make sure all of your toes are pointing forward, and do a stretch that way. Leaning back gives you more of a stretch. If that area isn't tight, you probably aren't going to feel a really good stretch even coming in through here. So that's not a big deal. With any stretch, you want to hold it 30 seconds and you want to do 6 of them. And the next stretch you can do, and it's something you should be doing even if you're not in pain. This one you can do sitting up. I'm going to show you lying down, but this is the figure 4 stretch, and this is going to hit kind of this outside and the back area of your hip. All you're going to do is just start on the ground, cross your leg over, okay? So you're in this figure 4 position. And then you're just going to pull your leg up to your chest. Now, many of you will feel a stretch right here. That's okay. That's where you stop. If you don't feel a stretch, then you can reach down and you can pull your leg up to your chest. If you can't reach down and pull, you can put your foot up on a wall. You can do a number of things. You can also do this sitting up. You can do sitting on the ground like this, sitting in a chair. The main thing is when you do it sitting up, though, you want to make sure your back is nice and straight and you're hinging from the hips. Okay? You're not doing this. And then the final thing that you want to try and do is just a simple hamstring stretch. So again, for the hamstring stretch, you can do this standing, you can do this sitting. I'm going to show you sitting. The one thing you want to do, you can do it both legs together. You can do it one leg at a time. Again, for the hamstring stretch, you do not want to collapse. Okay? You want to sit up nice and straight and hinge from your hip. So this part should be nice and rigid and straight. You don't want to be You're not really going to be stretching your hamstring. Even though you might feel it, you're not really going to be isolating that hamstring when you lean forward or when you collapse forward. Again, those are 30-second hold, and you want to do 6 of them. Those are things that you should be doing every day, regardless of whether you have that sudden injury. But that pain, the longer you ignore it, or if you kind of walk through it, it means that there's something going on, and you need to get it diagnosed, or else it's going to come back, and maybe next time you won't be able to ignore it or walk through it or just kind of shake it off. If you or someone you know is suffering with pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good day.